Okay, well, why don't we go ahead and get started and let some others join us as we go. Wanted to talk a bit about a couple of items that are distinguish work comp from group health. We know from a medical standpoint, workers' compensation and group health are much the same. We care for patients basically the same way in both cases, but there's some administrative and claim management differences that distinguish workers' compensation. And we really need to be alert to these and to be managing those aspects that the carriers and the patients expect and employers expect us to manage. So there are a couple of examples of those that I want to talk about today. One's a job stress claim that I think is illustrative of a situation that we confront from time to time and how to deal with that. Second is work status, particularly modified work, and how to go about that. Some of the challenges in determining how to handle work status. And then finally, reporting PR2s and PR4s. There continue to be questions. In some cases, is a PR2 the right thing to do? Is a PR4 the right thing to do? How do you decide who really ought to be doing them? So we've got some examples of those to talk about. So managing job stress claims. There's a patient that I saw actually recently, who's a checker at Foodmax. Complaints of job stress began in 2019. She reported coworkers making critical and hostile comments to her, recently physically pushed by one of them. There was no injury, but she felt distressed that occurred. And as well, she said that her supervisor was not particularly responsive to this situation and just not solving it for her. She had permanent work restrictions from one or more prior job injuries that included a 10-minute break every hour. When she attempted to take her break, she closed her customer check-in line, I guess with people still standing in line, which caused unhappiness with those standing there and who may periodically verbally abuse her. I can appreciate the frustration of the customers. And then her symptoms included anxiety, depression, headaches, insomnia, and fear for her safety. History also included the fact that she'd had 4 prior job injuries, including upper back injury, lower back injury, shoulder, hand, all of which settled with future medical care. She denied prior job stress claim. And on exam, not much to be found, just a normal female who appeared anxious, frustrated, complained of insomnia and depression. So it's a not uncommon situation in job stress claims, at least that I see, that unhappy worker in the workplace and is feeling probably bona fide stress, not much question about that. But then how do you handle this, and what qualifies as bona fide job stress is the issue. So when one looks to the regulations, we can kind of translate this, but the wording is a psychiatric injury shall be compensable if it is a mental disorder which causes disability or need for medical treatment, and it is diagnosed using terminology and criteria of the American Psychiatric Association's DSM Manual of Mental Disorders, 3rd edition, or the terminology and diagnostic criteria of other psychiatric diagnostic manuals generally approved and accepted nationally by practitioners in the field of psychiatric medicine. So the first step in determining that there's a bona fide job stress claim or making a judgment about it is there some sort of psychiatric injury that has occurred? And we observe the symptoms I don't happen to have a copy of the DSM-3, but and so we don't know the precise terminology, although I've got some examples in following slides. But we need to try and use a diagnostic term that's appropriate for whatever's happening with the patient. And our diagnostic terms really shouldn't be symptoms, but they should be something that is a bona fide diagnostic term. And so, for example, those that appear in DSM-3 are several. And my experience, and perhaps yours, is that most common are the following, the ones that are underlined and in bold: acute stress disorder, post-traumatic stress disorder, and depressive disorders. There are other things that can occur that will be represented as job-related stress, but most are going to fall into these categories. And so the first step when we're drawing a conclusion about what's going on with a patient is to assign an appropriate diagnosis, and it should be a bona fide diagnostic term. Again, not symptoms: insomnia, anxiety, unhappiness, or whatever. There are others that may occasionally appear and masquerade as a job-related injury, such as those listed: bipolar and related disorders and general anxiety disorders. But these aren't normally going to be, in the end, considered job-related conditions, although there's some potential if a job-related situation exacerbates or aggravates a bona fide pre-existing problem. So when you're thinking, first step, about considering something to be job-related, think about a bona fide diagnostic psychiatric term. Now, then the second step is determining if the psychiatric injury is actually compensable. And the definition in the regs is as follows: in order to, and this is California Code of Regulations, in order to establish the psychiatric injury is compensable, an employee shall demonstrate by a preponderance of the evidence that actual events of employment were predominant as to all causes combined of the psychiatric injury, at least 51% of the causation from all sources combined. This is a tricky thing to do. And what they're asking us to do, because most folks walking around have some degree of anxiety, it's something we all experience, or some symptoms of mental distress. The question is, if an employee presents in a situation where there's complaint of job-related stress, are the symptoms that the employee has preponderant from the job? And in the work comp world, preponderance means 51% or greater. And we use the term when a diagnosis is, and whether it's a psych claim or some other injury, probable. When we use the word probable, we mean that something is 51% likely or more likely than not. Possible is 50% or less. So what they're saying in a job stress claim is whatever the employee presents with, at least if you try and assess the aggregate anxiety that employee is experiencing from all causes, job-related stress plus financial anxiety, plus marital anxiety, plus kids and all the other stressors, divorce, all the other stressors that go on in our lives, the job-related portion needs to be in the majority, at least 51%. And the challenge is, how do you assess that? And that isn't always easy to do. We make our best judgments about that, but this is where one of the challenges occurs for us to decide what's when you aggregate all the stress that occurs with an employee, how much is really related to work. So we end up making our best judgment there. Now, the labor code also provides the following guidance. In the case of employees whose injuries resulted from being the victim of a violent act or direct exposure to a significant violent act, the employee shall be required to demonstrate by a preponderance of the evidence that actual events of employment or a substantial cause of the injury. That's what essentially we said just in the last slide. For purposes of this section, substantial cause means at least 35 to 40% of causation from all sources combined. What that refers to is the employee who has an actual stressful event occur that's the cause. If there's a specific event, it's not the accumulation of stress on the job from whatever things are going on. It's a particular event. So it's the Domino's pizza guy who is injured, beat up, trying to deliver his pizza. It's the check casher in the check cashing company office where there's a holdup and perhaps threatened or maybe even hurt. A specific event like that or something other. And occasionally it can even be, if there's a physical injury, fall from a height. And these are generally unexpected events. In fact, they're always unexpected events. Then there may be some stress related to that. So in the case where there's something specific that's happened, that's the generator of the stress, whatever symptoms the patient's experiencing, the threshold lowers to 35 to 40%. And again, it's in the aggregate. So it's all stressors in the person's life. And our role is to try and determine, make our best guess as to what contribution the event has made. And this, of course, is a large challenge. And it's not really something we can very well do in the 10 or 15 minutes in most cases we have with a patient, which will lead to some comments I'll have about how we really ought to be handling this. So in any event, what we want to be doing is trying in the time we have with the patient to determine what's going on from an emotional, a psychiatric standpoint related to the event that occurred or whatever the stressors are, and try and assess, if possible, what other stressors are happening in the patient's life that may be contributing as well. And so in the end, a job-related stress claim is going to be accepted only if it meets that threshold and some other criteria.
Steve?
Yes.
Not to digress, but I've had on a rare occasion a situation where a worker was assaulted by a co-worker during work hours, but the reason for the assault had nothing to do with the employment. It was a personal grudge. How does that fit into this?
That's a great question, Mickey. And what'll happen is that can be considered job-related stress. It can be a specific action. There's some criteria, though, that have to be met or excluded. One is, as long as alcohol was not involved on the part of the injured party. Second, as long as the injured party was not the instigator of whatever happened. If there has been alcohol and the injured party is intoxicated or any other drug for that matter, then that will be excluded. If the person that was injured was the instigator of the situation, then it will be excluded. And if it's hard to determine who instigated it, it may well be excluded. So there are circumstances like that where it may well be concluded if there is indeed some sort of bona fide stress in addition to whatever the physical injury is. When there's a physical injury, then if those situations I described are not present, then the situation, the physical injury and maybe the psychiatric injury will be considered job related. Now, here's the thing, in a couple of slides, what my suggestion is going to be. It's very difficult in some of these to know, for us to make the judgment. And so I think this is one of the rare situations where we, in many cases, want to be equivocating on causation. Let me give a little bit more information. No compensation shall be paid unless the employee demonstrates by a preponderance of the evidence that actual events of employment were predominant. That comes from the 2 slides ago. as to all causes combined in the psychiatric injury, and one or more of the following conditions exist. So we mentioned sudden and extraordinary evidence of employment were the cause of the injury, or upon finding of sexual or racial harassment by any trier of fact, whether contractual, administrative, regulatory, or judicial. In other words, what that means is the carrier, the work comp judge, or some other administrative person that may be involved in the decision-making process. So there are two criteria these days from our standpoint that are significant that we need to determine. Number one, was there a sudden extraordinary event, as mentioned, or was there sexual or racial harassment involved in this? And that is sometimes more difficult to determine. Sometimes employees will contend that there's some sort of harassment where in the end it doesn't prove to be true. But those are the criteria. The definition of job-related stress has evolved over the decades that I've been doing this. And long ago, if an employee got a bad job review, if they were reprimanded for some sort of performance issue, if they complained about something and it went unheeded, if they're working in an environment that's stressful and all other employees are subject to the same stress, they don't like their work hours or any other number of things like that, the stress that arose from those was considered job-related. And there were a large number of job-related stress claims. Over the years, through legislative and regulatory refinement, the number of claims or situations that are considered job-related have diminished significantly. And now they're just, for our purposes, these two things, an extraordinary event or this harassment. There are, I say here, other criteria on related decision-making. So there are other situations where there may be, a claim may be accepted, but they don't apply to us. Those are ones that have to do with case law and or situations where there's some history with the carrier of a reason to accept a claim. But those are things generally we're not going to know. And so we need to be focusing on these two criteria. Now, if there was a specific event or discrimination, the question then is something job-related or is it not? And so therefore, job-related stress is one of these two criteria. And if something doesn't meet that, a case doesn't meet that, then it's considered a personnel action. That's the term of art. And what that means, it's really an HR issue. And so the burden in work comp is for the aggrieved employee to demonstrate one of those two things, the extraordinary event or harassment. And if those aren't found to be present, then the claim is considered employment action. So the burden's on the employee to provide that evidence, and the aggregate stress, as mentioned in earlier slides, needs to reach the threshold, 35 or 40% or 51%. If those aren't met, then it just falls into employment action, and a claim will just frankly not be accepted as job-related stress. Now, also significant is no compensation on its division shall be paid by an employer for psychiatric injury if the injury is substantially caused by lawful, non-discriminatory, good faith personnel action. The burden of the proof here shall rise to the party. In other words, if there's not, this is the terminology that refers to what's a employment action. It's that if the criteria aren't met, then it's not going to be accepted, and there's going to be no wage replacement, for example, when a patient's off work. And there's
sorry, Steve.
Yes.
How does one get this information
about which the whether
how does the patient get the burden of proof and provide it to the physician in some sort of tangible evidence. But it's been my experience that human resources people aren't too free to divulge into information on personnel actions. How do we gather that?
Oh, well, if it's, this all comes to us by the patient's history. So what we're looking for is whether a specific event or where there's some evidence that the patient reports of harassment. Now, what'll happen then in these claims is that we'll make our best judgment. And we have three options as usual, as we do with any other work comp claim. One is, yes, we agree this is job-related problem. No, we think it's non-job related, or one, we're not sure. And my advice in these cases is, if we're absolutely certain that it's job-related, in other words, there was a specific injury, specific event that nobody denies, then that really is going to be reasonably accepted by the carrier as job-related. If, on the other hand, and an example is this patient I just gave, if it's an unhappy employee, there's nothing that's presented as evidence of sexual or racial discrimination. If there's none of that, then these fall in the middle, kind of a gray zone. And more than half that I see, I end up deferring on this and just saying it's not possible to make the judgment, because what'll happen is the carrier will take the patient's statement, the carrier will talk to the employer, particularly HR, and ask for a prior medical records on the patient, and a claim will be put on delay. So the carrier has 90 days to make a decision as to whether or not they're going to accept the claim. So my opinion is, if we're not really pretty sure of the first or the last category, in other words, yes, it is for sure, or no, it's not for sure, then if there's any question, I would just say unable to make the decision, and the carrier can make a referral to a QME, and again, they're going to put the claim on delay no matter what in the case of work comp. So all we have to go with is what the patient tells us, and we make our best judgments from that information, unless the employer also sends additional information indicating, yes, something happened on the job, there was a holdup or there was whatever. So we don't normally go, we wouldn't go to HR or any place else to gather outside information. That's something that the carrier is going to do.
Okay, thank you.
So welcome. So we just make our best judgment based upon what's handed to us when the patient comes in. And that's the challenge with this. Not only what's the accurate history, but what's been the patient's medical or psychiatric history in the past. And that takes oftentimes a lot of time and more experience than most of us have in ferreting through, rummaging through the patient's, mental history. So when you get these, my recommendation, unless you're really sure about it, is to defer. Now, so how to handle these things? Everybody, all of us are going to do it slightly differently, and I'm just going to toss out suggestions, and you all come to whatever your own conclusions are about how to manage these cases, just like any other cases. There's a lot of a judgment involved. So the approach I take is, number one, these folks all come in with some degree of stress, whatever the source. It's rare that somebody is feigning this, that they're malingering. If they're going to malinger, they're going to malinger about something else most of the time. So, I just try and recognize and be sympathetic to whatever's going on with that's generating their complaints. I generally explain to them, after I've listened to them for a little bit, how work comp works and what the criteria for job stress are. And it's these two things that we've been talking about. And that in the absence of one of those occurring, then the claim is just not likely to be accepted. I offer to take the employee off work for an appropriate period. This is one of the rare times that my recommendation is to take somebody off work. Normally we're thinking about modified work, but no matter what the stress is, it may well be that the employee just needs to be off work. But I also emphasize to them that the claim is going to be put on delay and there's no wage replacement during that period. If in the end the employer agrees, or the carrier agrees that there's a bona fide job claim, then they'll go back retroactively and make up that missed wage. But otherwise, there is no wage replacement during this time. Seek solutions in the workplace. Those that you can see are really HR issues. They don't get along with the supervisor. They don't get along with the co-workers, or they don't like their hours or whatever other kind of thing. Then the answer to that is look for a solution on the job. Sometimes people just need to quit. I don't usually tell them that, but it may be that this is just not a good job for them. So they need to make that kind of decision, looking to the workplace when appropriate to find solutions to this. And if you have the sense, the way I look at this is, if my sense of it is that's where the answer is going to be found, that the answer is not going to be in counseling, medication, etc. It's going to be in looking at the workplace and having the employee trying to solve the problem there, then it means most of the time that's going to be an employment issue. Emphasize the carrier will make a decision about compensability, and they're going to oftentimes go right up to the 89th day before they make a decision. And then on a doctor's first report, I indicate that compensability, job relatedness is uncertain. And I'll often make a note, the carrier may want a psychiatric QME, but I mean, they don't need us to decide that. But that's where I think the solution oftentimes will end up lying. Refer mental health counseling if the patient desires. At this point, if the claim's not accepted, then let me back up and say this. When a claim's on delay in regulation and actually in law, the carrier is required to provide care, pay for care up to an aggregate of $10,000, physical or mental injury, as long as we're treating consistent with the MTUS, medical treatment utilization schedule. So we can go ahead and do medical or psychiatric things, make referrals without the claim having been accepted. Now, from the referral standpoint, most of the specialists we refer to, whether they're psychiatric or some sort of physical illness, aren't going to see a claim, aren't going to accept, or aren't going to be willing to see a patient without a claim number and authorization. We still have to get authorization from the carrier. But we just go ahead and there's a group in Watsonville, Aptos area, Torres group. All they treat is work comp and stress or work comp claims, mental health claims. So we'll often make a referral there, or if it seems like to me in the end this is more likely than not going to be accepted, encourage them to look at their group health insurance and see if they can find somebody on the network that would see them. So that's a little tricky. And then finally, resist the temptation to become the patient's mental health counselor. From time to time, I see cases where we're treating patients. It's gone on for a while. We've got folks on medication. We're trying to, be supportive and give them counseling. And I just don't know that in general, we have the time or the expertise usually to be doing that. So I would discourage us, frankly, from trying to become the patient's mental health counselor. But, do whatever you think is best for the patient that you think you're capable of doing. And, if it seems appropriate, then, you proceed with that. But I think that would not be our first choice most of the time in managing these claims. Anybody had any? Yes, go ahead. Sorry.
Steve, can I make just two quick points?
Yes.
So I think this is really clear. This is really nice to have this summary of what to do, because these can often be sort of head scratchers. 2 points I would make is the investigation that the employers do on these patients is pretty exhaustive. So if the patient does have an extensive psychiatric history, for example, I usually tell the patient, this is all going to be available now. This is the insurance company is going to get all your records. So it's pretty invasive look back in your history, and sometimes they'll kind of scratch their head and go, I don't know, if that's really what I want to happen. The second point is I actually find in most cases that the carrier does actually pay for the therapy. That's what I usually send people to. I take them off work and send them, put a referral into psychotherapy. And actually, I find the therapy is paid for until that 90-day point. Often, I guess the last point I want to make is 90 days is often all it takes to resolve most of these cases, I find, that are sort of shaky, that either the patient has found a new job, has worked it out with HR to get out of the toxic environment, or has somehow resolved the conflict, and that at 90 days they're actually ready to go back to work. So I wouldn't be afraid to take someone off. I usually bring them back every 30 days and see how they're doing. But a lot of times these cases will work themselves out during that 90-day period.
Yes, those are really good points. I agree with that, Scott. And part of that is, as I mentioned, those things that really seem to be like employment issues, encouraging, that's why I say encouraging the patient to try and seek local, work site solutions to disgruntlement issues. Sometimes people, in fact, not infrequently, have bona fide, problems with the work assignment or something, and that can really be stressful. I mean, there may be conflicts with the kids at home and their schedule, or the variety of things. But so if those can be solved on the job, that's the preferred thing. And yes, those tend to wash out oftentimes in less than 90 days. Just one additional thought you had mentioned about the employer gathering information. The carrier gathers the information. The employer generally is not going to be privy to some of the kind of information that the carrier will gather from other sources. But I don't know how much exchange does occur there. But I think HIPAA issues and others, confidentiality issues, do apply. So yes, you're entirely right. There's going to be a lot of rummaging around in their medical history, psychiatric history. So, in any event, these recommendations are ones to think about. Come up with your own plan. Do what is comfortable and works for you. But I would at least give some thought to these suggestions that we presented. Any other questions about this? Okay, let me stop the recording.